I did my interventional spine fellowship training in Phoenix, Arizona. Prior to that, I was in Birmingham, Alabama for 4 years at the University of Alabama, Birmingham. I did my medical school and undergraduate at Louisiana State University. I chose to become a physician with the genuine desire to help people. I came from a community where I saw other folks helping one another. We lived in a small community where everyone kind of knew their name. I found early on that I tend to excel in science. It's something that appealed to me quite a bit, and I just kind of matriculated towards the field of science as I got into college and decided to go into medical school. I realized very early on that English and literature was not my strong suit. I chose to specialize in interventional spine because as I was training, I realized that there was a gap in healthcare between treatment for spine care, whether that was pills versus the other extreme, which was surgery. And I thought that spine care was missing something in the middle. And so I sought to find a specialty that allowed us to look at the spine as any other musculoskeletal organ, such as the knee or the hip or the shoulder, and find non-surgical, minimally invasive ways to try and aid a person to recover from whatever spine injury that they had. In addition, interventional spine offers me the opportunity to practice electrodiagnostic medicine as well too. We can do nerve conduction studies and EMG testing to better define what a person's problem is to make sure that we're coming to an accurate diagnosis. And I also enjoyed reading MRI scans, and the ability for interventional spine to allow me to learn how to read MRI scans and apply that to what I was seeing in the decision-making process, I felt was a strong attribute of the field. The types of patients that typically present into our clinic vary in age. We can see a 15-year-old young athlete who may have been injured in a sporting event, his or her sporting event, to the 80 to 90-year-old patient that no longer can walk along their driveway to pick up their newspaper, to the weekend warriors, guys like my age in their 30s and 40s that still think that we're young, that get injured playing basketball and softball on the weekends. So we see everyone who has ranges of spine pain that involve the neck, the back, the neck and the arm, the back and the leg, along the middle part of the back as well too. Other folks that come into our clinic are those that we're asked to see to do nerve tests on. And so it might be someone who has numbness and tingling in their hand, their feet, and we're asked to perform electrical studies to better define what might be causing those symptoms. The thing that patients can expect when they come in for an office visit with us would be honesty first and foremost. We will try and explain to them in the most clear and understanding language without necessarily trying to sugarcoat things as to what the problem is. They can expect that they'll have a game plan, that we will try and lay out for them what we think will be their best option for helping them and give them hope and something to think about in a positive way, that the situation that they're dealing with is only temporary. I think they can expect compassion from myself and our office staff. They can expect ethical practices to be conducted as well too, that we will not order tests, do procedures, order imaging that is unnecessary for them. And I think that they can also expect us to hopefully try and stay on time most of the time.